Good afternoon, everyone. Thank you for joining us today. I'm Mary Cullinan, president of Eastern Washington University, and I'm very grateful to our esteemed panel for being with us today, as they are all very busy people during this stressful time. So when I first put this town hall together some weeks ago, I was still thinking about groups of people getting together in a big room. And Dr. Magori, who is on this panel, immediately recommended a virtual format. He was way ahead of most of us. So we've all learned a lot in the last few weeks, and I know we will learn more today from our panelists. So they are Dr. Krisztian Magori, a disease ecologist who focuses on vector-borne diseases. He has expertise in the statistical analysis and mathematical modeling of infectious disease outbreaks. Dr. Katie Taylor joins us from the Department of Wellness and Movement Sciences. Her background is in exercise, health, and wellness. She taught classes in critical health issues and health promotion while at the University of Idaho, and now teaches epidemiology in the undergraduate public health program here at Eastern. Dr. Sarah Mount earned her doctorate at the University of Texas and is program director and professor for public health at Eastern. And Dr. David Line, director of the Eastern Masters of Public Health program, has field experience as a county public health emergency preparedness division manager responding to outbreaks of the pneumatic plague, hantavirus, West Vile, and measles in Arizona and New Mexico. These experiences are part of his 20 years in incident management. So I very much appreciate all of you being here, and I appreciate our panelists, and I will turn this over to our provost, Dr. David May.
Thank you, Dr. Cullinan, and I would very much like to add my thanks to the members of our panel today. Before we get started with the many questions that have come in, Dr. Mount is going to sort of frame the discussion for us by presenting us some underlying information and definitions that we'll be using going forward. So, Dr. Mount.
We thought it would be a good idea to try to get everyone on the same page regarding some definitions, some terminology that you have certainly heard, but it's important to understand, in fact, how the CDC is interpreting these terms. So the first distinction is between the coronavirus and COVID-19. Coronavirus is the actual virus itself, while COVID-19 is the disease that occurred as a result of this virus. So SARS in 2003 is an example of another coronavirus. We have also been learning about epidemics and pandemics. An epidemic is an occurrence of a disease that occurs more than what is expected. So because this is a new strain, the first time that it occurred, it would be considered an epidemic, technically speaking. A pandemic is an epidemic that is spread worldwide or across a large geographical area. We've been hearing a lot about quarantines and isolation. A quarantine is when we separate someone or restrict their movement because we are concerned that they have been exposed to the virus, but they are not yet showing symptoms. Isolation, on the other hand, is someone who is ill, and we are separating them to try to contain the virus. And finally, number of cases versus number of confirmed cases. We will never actually know, nor will any government or reporting institution know the total number of cases. All we can talk about and be concerned with are those that are confirmed.
Thank you very much. We had a lot of questions submitted, and we're going to go through these as quickly as we can and try to provide the best answers that we can. So the first question is, what are the symptoms of COVID-19, and how can you distinguish this illness from a common cold?
So I'm sure many of you watching and listening are wondering whether or not you have the coronavirus, and some of you might have symptoms that you think might be compatible. So it might be useful to think about what are those symptoms and what other things you might have that have similar symptoms. Do you really need to go to the doctor to get tested or not? So the symptoms of this COVID-19 disease is fever, dry cough, and shortness of breath. Those are the most common symptoms. The strangest of those symptoms is shortness of breath. Most other infections that we have do not cause shortness of breath. In other infections, it takes considerable amount of infection, severe symptoms before it gets to shortness of breath. Whereas with this coronavirus, that is a fairly common symptom. You can also compare the symptoms to symptoms of the common cold and the flu. Since you can have either one of those, this is still the flu season. With the flu, you do have fever and you can have dry cough. However, shortness of breath, again, is not a hallmark of a flu infection. Also with the flu, it's more common to have headaches and also body aches and sore throat, which are less common with this particular infection. Interestingly, the common cold, if you're seeing people sneezing and wiping their noses, don't think that they necessarily have COVID-19 infection, because the common cold is likely to cause sneezing and runny nose. This coronavirus, the COVID-19, usually does not cause a runny nose and sneezing.
Thank you. How dangerous is COVID-19 compared to something like the common flu, and what is the mortality rate?
Because the symptoms are showing up, because the people who are not showing symptoms are spreading the disease, it is 3 to 4 times more dangerous, all the way to, some experts are considering it to be 10 times more dangerous.
Here's a slide. It is not our most current reflection of the data. However, it is based on 55,000 individuals in China that were impacted, and this is comparing the case fatality rate, that's CFR. And if you look here at the orange bars, this is representing our population that is over 65, so you can see that the difference is significant.
And I would add to that that the seasonal flu only kills 0.1% of people, because that's not something everybody knows.
Globally, we're at 3.7% right now.
Wow. So something I've been hearing a lot is this sounds like a different type of flu. It's mild in most people and doesn't even affect kids. Can't we just take normal flu precautions and call it good? Why is there so much more anxiety about this than influenza? Why so much concern when 20,000 people here in the U.S. have died from the flu in the last 4 months?
Because it spreads easier, it hides longer, and it's more lethal, this is a significant issue. And until we have what we call herd immunity, or at least public immunity as a group to the disease, it's going to continue to rebound and come around and visit us again. That is a major concern, and we need to eliminate that, or at least make it so that as it spreads itself, we can protract the disease to the point where everybody that needs care can get care.
Sarah, maybe this would be a good time to show that curve. So you might have heard the term flatten the curve in the media in the last couple of days. So what that's about is making sure that we don't have many people showing up at the hospital at the same time who all need critical care. And this is possible with this coronavirus because none of us have immunity to it. We've never been infected with it. And so the disease, we are all susceptible to it. And so the disease can transmit very efficiently. Whereas with the flu, even though, yes, there are many flu infections, a large proportion of the population is either vaccinated or had a similar influenza infection before. So that's another thing that's different between these two infections.
Thank you. The question on everyone's mind is, do masks really help?
This is a great question. If you have been to supermarkets recently, you've probably noticed we are running low on many supplies, including masks. The masks that you can typically buy in supermarkets are not going to completely prevent the transmission of this disease. So how it is transmitted is through droplets from the respiratory tract. So if someone is to cough in your direction, and then that enters into your body, whether that through the respiratory tract, eyes, nose, those sorts of things, or onto your own hands, and then you were to touch your face, then we can transmit this disease to one another. So masks have been used to try and mitigate this, but the masks that you typically will buy are not going to completely restrict that transmission of the disease. Equally, they are a good way to kind of stop someone from touching their face, touching their mouth, touching their nose, particularly when in social situations where social distancing cannot be avoided necessarily. But what we would say is that trying to not hoard masks, they are going to be useful, particularly for those that are at what we'd consider to be higher risk and more susceptible to COVID-19, and that they may not completely mitigate the risk completely.
I would also add that healthcare workers will need those masks because they have to work with infected patients in the next couple of months. And we don't want them not having proper equipment and protection because if they get sick, then who's going to treat them?
So bottom line, should I take it upon myself to wear a mask, even though you're suggesting that it may only be partially helpful?
That is somewhat person dependent. It can definitely help people reduce anxiety around transmission of the disease, which there's something to be said for that in of itself. But I would do so in a way that you are not restricting those supplies for people that are at greater need, the healthcare workers, those are at a higher risk of susceptibility to this disease, the older populations, as well as those with lung diseases, those sorts of things that are going to make them at higher risk for complications as well of COVID-19. And so the CDC currently does not recommend the use of masks for all people. But if you are to go out in a social situation where you cannot prevent social distancing, then I would say if you feel more comfortable and they are available and you're not hoarding them, then there is no harm to be done. But we do need to make sure that these resources are available for our healthcare workers and those at a higher level of risk.
So this next question comes from a student, but maybe you could address it a little more broadly. What can I do realistically as a student, or really as any member of the EWU community, to help make the university safer in this situation?
So the university has already done what it can to protect members by putting classes online, and that's great because students are not put into close proximity where they could infect each other. But in general, I would recommend what we call social distancing, or maybe we should call it physical distancing, trying to stay at least 6 feet away from others, and not just from those people who are visibly symptomatic, so people who are coughing and having fever and symptoms, because you can't really tell. There is an indication that people can be infectious even when they are asymptomatic. And so in general, practicing social distancing, staying out of large groups, I have been hearing reports of people still coming together to have St. Patrick's Day parties, go on spring break, holidays, and having a party at the beach. Those are not generally good ideas right now.
we want to keep all our students here at EWU as safe as possible, so continuing with normal hygiene practices, washing hands at any opportunity where you've had contact with anything outside of your home, in particular other people. Also making sure places, commonly used surfaces at home are cleaned, and then if you do not have access to washing your hands with soap and water for the recommended 20 seconds, then being able to use a hand sanitizer that has at least 60% alcohol will help keep yourself safe in these situations.
I'd like to expand upon what Krisztian was sharing in terms of referring to this as physical distancing instead of social distancing. You know, there have been a number of occasions in our history where tragedy or crisis, we come out the other side and we're closer, we have bonded, we have bridged different aspects of our campus and our community together. We are stronger on the other side because of it, and we have improved our social capital because of it. So I do think it's important to point out that maintaining social contact, connection, and expanding those networks is really important at a time like this. So I actually came up with a challenge for all of you. And this includes faculty, administration, students. I'd like for you to pick 2 people during the spring quarter that you're going to reach out to. That is not someone you would normally reach out to. Maybe it's someone that you were in class with and you were friendly with and you respected and appreciate, but maybe not someone that you visit with on a regular basis. And I want you to reach out to them. Go ahead and put it on your calendar right now. One day that you're going to reach out to someone else, check in on them, see how they're doing, see how the quarter's treating them. Twice this quarter. If you're overly ambitious, you might reach out to 2 people per week. But I do think it's really important that we focus on our social connections with each other and figure out how to support one another.
And to that end, I would add that we want to help support the university as an institution, and ways we can do that are support the transition to online. We can also support administration as they go through the response. And then finally, I think this is an opportunity where you can reflect, you will want to reflect back in many years on what you did during this period of time. There's every evidence that this will be a point in time that you will remember for the rest of your life.
Thank you. What are the chances that somebody on our campus or in our community has the COVID-19 and is either unaware or is asymptomatic?
So first of all, I'd like to stress that we do not have a confirmed case of COVID-19 on campus, as far as I know. That does not mean that there isn't any one of us who might be infected and not know, because we know that 80% of the cases are mild. I might have a sore throat a little bit, maybe feeling a little bit under the weather, and I'm thinking, well, I'm sure it's not COVID-19, it's fine, I can still go to work. And so I come to work and do my job. And we also know that 30% of the cases are completely asymptomatic. They would have no way of knowing that they might have this infection. Those people can still transmit the disease, even though at lower probability, like half as much infectious as others that are symptomatic. And so there's really no way to rule it out. Unfortunately, we don't have drive-through testing facilities where we could all go and be in our cars and get tested. Maybe at some point in time we will have those, and then we will have a better idea. But while we don't have any confirmation, we can't rule out that anybody could really be infected and infectious. And that's why we need to practice the social distancing practices and the hand hygiene and other hygiene procedures to protect ourselves from infection.
So how likely am I to contract this disease while traveling domestically or internationally?
So cases of COVID-19 are all over our country at this point. So although there's not a travel ban per se, airports are pretty empty at this time. People are not traveling. If COVID-19 is spreading, the destination you're going to, but not where you live, you may be at higher risk for exposure. If it's spreading where you live, and you're going to a destination where it is not as prevalent, then you are then risking possibly infecting others. So, is there a chance to contract the illness when traveling domestically? Absolutely. And I believe the agreed upon recommendation would be to be very conservative in your travel plans.
That risk is definitely elevated when flying currently due to the contained spaces and your inability to social distance on a plane, particularly with those that are around you in close proximity. And so that would be one way. So if you must travel and have the option to drive, then that is considered currently safer to do so. And it's prudent for everyone to monitor international travel. The President of the United States has currently got things in place that disallow travel internationally to certain countries, and so you want to be able to monitor that at all times so that you can prepare accordingly.
So what if I felt ill, went to the hospital, got tested, although I think you might address whether I'm going to the hospital or not as a first step. If I felt ill, went and got tested, and the test came back negative, what should I do differently?
So first of all, be happy you're not infected with this virus. Although it is possible that if you go too quick, maybe it's more difficult to detect. By the time people have symptoms, they generally have enough virus in their blood that could be picked up by the test. The tests are very effective. So there are obviously many different respiratory pathogens going around. This is still the flu season. There are other cold viruses, which, by the way, are also coronaviruses. We just usually don't worry about them because they don't kill as many people. And so you could have some other kind of infection. So with that negative result, again, you should just be lucky and then practice the same guidelines and precautions that everybody else has to practice.
To your comment, Provost May, about visiting the hospital, if you do show symptoms, you should actually phone your healthcare provider, first of all, to determine the right place to go. Not all places in Spokane currently have the ability to run the tests necessary to test for COVID-19. There is also an increase in tele-doctoring, and so you can actually, I know that multi-care is just one of a few, not that I have any association with them, one of a few that are able to review your symptomology via the internet. So you log in, you are asked a series of questions, and they will determine from that whether they need to speak to you on the phone, whether you need to come in to be tested, or whether you can remedy this at home as you would with the common cold. And so that's a really great resource that's being utilized by many at this time. If you do think you have symptoms, please, as much as possible, make the phone call before turning up at the ER or the urgent care rooms or your doctor's office. You don't want to be told they can't do that test and then potentially increase that risk for other people by transmitting the virus that you may or may not have. So,
Thank you very much. So this is a very specific question. I saw someone who was very ill, had a face mask, but was not wearing it. They were coughing a lot, exposing myself and others to whatever the illness was via air droplets. How are we supposed to keep ourselves safe in these situations?
So in this situation, after supporting the other person as best you should, you would want to consider yourself contaminated. Therefore, you would want to wash your hands at the earliest opportunity. The next thing you would want to consider is where else on your person, your clothes, or any other objects you have, such as a cell phone, the droplets fell. The study out of University of California, Los Angeles, which is the one that I'm most familiar with, is saying that the coronavirus can live outside of the body for 3 days on hard plastics and stainless steel. Other hard metals fall in this line. although copper does seem to have a diminishing length. On things like cardboard, it's 1 day, and then fabrics are between 2 hours and 2 days. The next thing to consider is what other aspects, such as the sun, are impacting that surface. So leaving a cardboard box out in the sun would be a very good idea if you were to have food delivered to you.
Once recovered from the symptoms of COVID-19, is a person no longer vulnerable to reinfection, or does the virus remain active in the person, meaning symptoms can reoccur?
So this is a question that has been asked a lot in social media and on the internet. And there is no evidence to show that this virus, the SARS-CoV-2 virus, which causes the COVID-19, would be able to be a chronic infection in the body. Everybody seems to go through the infection, and then those who survive will fight off the virus and recover and become immune, at least for a period of time. So I don't believe that it would be causing long-term illness and recurring symptoms like, say, for example, recurring malaria. This is not something like that. And in terms of the reinfection, the literature on coronaviruses shows that there is a robust immune response that our bodies mount against the virus, and that immune response generates antibodies that reside in the body for at least 1 or 2 years. So if we have gone through the infection, we should be protected at least for that amount of time from a reinfection.
What about pets?
So that's another rumor that has been spreading on social media. So pets, there are many different types of coronaviruses. There's actually 4 different families of coronaviruses. There's alpha, beta, gamma, and delta. And human coronaviruses are in the alpha and beta categories. And there are other coronaviruses that do infect our pets. There's a cat-specific coronavirus. There's a dog-specific coronavirus. Those typically do not infect humans. I say typically because there are special occasions when things can happen. So for example, if someone is immunocompromised, they could get infected by a virus from a pet. But those are not common occurrences. I have not seen evidence in the literature of this particular virus being able to infect pets as cats and dogs. Their bodies are just a little bit different enough. That being said, this is a zoonotic virus. We know it came over from bats, or at least that's the leading hypothesis. So these jumps, these host jumps do occur, but they occur very, very infrequently. And it's very unlikely that another species jump would occur from humans to cats or dogs during this particular pandemic.
Thank you. This has been touched on a little bit, but I know it's of a great concern to a lot of people. Is the virus only potentially life-threatening to older people or those with weakened immune systems?
So those are the 2 major factors that have been identified, but I think we're largely overlooking a third, and we tend not to acknowledge or talk about the third until once we're beyond the crisis, and that would be the population of low SES, low socioeconomic status, low income individuals who will be more at risk because of this. And this is for a number of reasons. The first reasons that come to mind tend to be in the areas of access to health care, health insurance, et cetera. But we also know that communities tend to cluster together by economic status. And so transmission can be increased because of that, living in more densely populated areas. So this is important because we need to, I think, start that conversation now, recognize that now, so that we can take make the effort that is required to help before it's too late with this particular population.
To that end, I think that the current administration is suggesting, from what I heard this morning, that we have $850 billion, so basically $1 trillion that may be allocated to address this issue. Having direct payments is a very good idea if we're going to require people to not work for a period of time. So it's really just not reasonable for people on low economic situations to take time off, especially if they're not getting directly impacted and we're trying to develop a herd response to this situation. So therefore, making it so that they're not impacted would be a big step. The numbers that I'm seeing are also suggesting that the impact is greatest for those that are over 70, that are of higher economic statuses, and it's in the 55 and over for those that are of lower economic status.
A little bit of a longer question, and it involves health terms, so I'll try to pronounce everything correctly. What qualifies as a health condition that predisposes someone to higher risk? I'm on a biologic for an autoimmune disease and have other conditions. How worried should I be? I have cardiovascular disease, COPD, and liver disease. Is it safe for me to go to class?
So this is a great question and actually covers a number of different topics around this idea. First of all, as a reminder, you now come to class online, so we have mitigated that risk a little bit by putting all individuals in a safer situation and being able to social distance and not having to be in large crowds of people. This question brings up two components, though. One is the weakened immune system, or anyone who is immunocompromised is thought to be at higher risk to get the disease initially. So their risk has increased for contracting COVID-19 because of that, what we would lay terms a weakened immune system, or what we really term is to be immunocompromised. And this can be caused by a number of different things. Age can cause this, so our older populations, as well as autoimmune diseases, anything like inflammatory bowel disease, type 1 diabetes, any of those, rheumatoid arthritis, anything that we would consider an autoimmune disease can make someone a little bit more likely to be able to contract this disease. The second piece is about those comorbidities around the disease, and that relates to if you already have a disease, a lung disease, something like COPD or chronic obstructive pulmonary disease, if you're asthmatic, also, if you have a cardiovascular disease, so anything to do with the heart, there is thought to be some more complications around COVID-19 and your ability to recover from that. And that's largely because of the mechanism by which the disease works. It actually will go into what are called the alveoli within the lungs, which is where oxygen and carbon dioxide will transfer. So it gets oxygen into our bodies, which is needed for a number of processes, and then get rid of carbon dioxide. And COVID-19 right now is thought to actually inhibit some of that process. So if you have a lung disease or a heart disease, cardiovascular disease, any sort of what we would term broadly a cardiorespiratory disease, then you can have some greater complications because you already have kind of a decreased state within that cardiorespiratory system that then add in COVID-19 and it kind of exacerbates it. So we do see greater comorbidities in those people when they're trying to recover from this disease than, say, the average person who does not have any of these diseases and is considered healthy and well at the time of contracting the disease. However, that's not to be said that even if you are considered healthy and well, that you may not have some difficulties or complications of COVID-19. Those have been reported, but they are much more in the minority.
So the last question we have today is something I'm sure is on everybody's mind. What are healthcare professionals doing right now to treat people with COVID-19 if there's no cure? And how soon might there be a cure or a vaccine?
So they're supporting the respiratory system, the immune systems, and other systems that are associated or impacted. Respirators and other things are the things that we are short on, and that's the crisis. If we had as many as we ever wished, we wouldn't have this crisis, but we don't and we shouldn't. So therefore, We're just trying to support those systems and make it so that they can have the opportunity to recover. And then as far as the vaccination is concerned, most people are saying that we won't have anything until at least after the holiday season, and therefore we should not anticipate that it's going to support us and help us in this current situation. Katie, you had something you wanted to add to that?
Yeah, on a positive note, we did start, I have nothing to do with it, the great scientists of the National Institute of Health that are working in the state of Washington right now on the west side did start phase 1 trials today by administering their first vaccine to 45 individuals in Seattle. So this is a great move. This goes to show just how quickly scientists are really working to try and combat this disease and this unknown quantity, essentially. So we have started trials with the vaccine, but these do take can take a significant amount of time, but at least we are starting to make the headway with this situation. And I would really echo what Dr. Mount said earlier. There is a lot that we can do as individuals right now in terms of personal health and hygiene, the practicality of that, distance between yourselves, and situations. Obviously, the state of Washington has done a lot to help assist with this, but really looking out for one another in these really difficult situations. This is an unprecedented time for everyone. We haven't seen anything like this in this century, and so it's really important that we do go above and beyond to look out for each other. And if you're students and listening to this, really looking out, reaching out to your faculty if you're struggling, keep them in the loop. We are here to help, and there are many resources at Eastern Washington University to be able to do that, and so use those resources that are really here to support you.
Thank you. We do have a few minutes left, so I'm going to open it up, and if there's any closing thoughts that any of you would like to put out there, I'm sure everybody out there would be happy to hear them.
So public health isn't about just your own personal health. It's really about the health of the public at large. And so, that's what we're trying to communicate here, is the importance of taking care of yourself and how that impacts others. But I had a really great realization the other day, and that was about nature and spending time in nature, which happens to be a research interest and a personal interest of mine. And there aren't any people around. It's not a place you're likely to pick up COVID-19. So spending time in nature, exercising, journaling. If you're spending a lot of time in your house that you're not normally there for all that extra time, pick up the guitar again. Start writing about this experience. It definitely is a historical time, and I think it's an opportunity to look for the silver lining.
And I would just continue my suggestion that we try to help each other and utilize this opportunity to expand our relationships with others.
Dr. Magori, Dr. Taylor?
Coming up to spring, take these 2 weeks. Once you finish your final exams this week, as Dr. Mount said, take some of those opportunities that are available that are not going to put you at increased risk, whether that's getting out for a walk, doing some exercise outside, taking up something new, but be ready when we come back to spring quarter. We know it's going to be a different time. Be patient with us faculty as we navigate how to use Zoom and make sure that we're not on mute as we're trying to lecture. Not that I've already done that once in a meeting in the last 7 days. And so we're all in this together over the next 12 weeks of this academic year, and then whatever is beyond that as well. Know that as faculty, we still have every student's back. We're here to support you in every way possible, as is the administration of this university. And then hopefully faculty and staff that are listening bond together. It is a difficult time not being able to walk down the hallway and annoy your colleagues. I really miss that piece. So now I annoy them via Zoom. So there are a lot of opportunities, and take of those. Don't social isolate yourself. I think that's really, really important because we know the impact that can have on your mental health. So although you are physically distancing yourself from one another to benefit the many, make sure you keep those social partnerships, being able to talk to one another, figure out Zoom together, figure out how to do a virtual background and all those sorts of things that we can do. So this is a real time, and I know it was mentioned yesterday in Town Hall, but when we become and highlight that we're an Eastern family, and I think that's going to be really important over the coming weeks.
And I would just like to add that if you feel inconvenienced or even upset by some of the changes that are being done, restaurants closed, all that sort of stuff, think about it as a service almost to people who would be getting sick otherwise. Think about how that's going to save somebody's grandparent or somebody's brother or sister, and think about that effort in that respect.
Well, I want to personally, on behalf of the institution, thank all four of you for your time today. An amazing amount of really incredible information. I learned many things, and so I thank you very much for your time. I believe that this will be available online, that it's being recorded, and so your reach will go far beyond the people who are able to watch right now. Thank you very much.
Thank you.
Thank you.